Hello, I'm going to go through chapter 43, which is assisting with eye and ear care. It starts with some information about eye diseases and disorders. So disorders of the external structure of the eye include blepharitis, which is chronic inflammation of the eyelid's edges. This can be caused by infection or by the same skin condition that causes dandruff. It is typically treated with antibiotic creams for severe cases. Ptosis is drooping of the upper eyelid to a point where the lid partially or completely covers the eye and interferes with vision. Surgery is often required for this correction so the patient can still see. A sty is the result of an eyelash follicle infection, usually caused by the Staph aureus virus or bacteria. Applying a warm, moist compress will help the sty to burst and then it can heal. Conjunctivitis is pink eye. It's inflammation of the conjunctiva. It can be caused by allergy, irritants, or infection. Because the cause can be bacteria or a virus, precautions need to be taken to prevent spreading an infection. And oftentimes they will treat it as if it's a bacterial infection in order for it to not be spread. Corneal ulcers and abrasions may be the result of an injury, infection, or combination of the two. Typically, antibiotics and ointments are used to control the pain during the healing process and prevent infection. Cataracts are cloudy or opaque areas in the normally clear lens of the eye. Treatment includes surgically removing the lens and insertion of an artificial lens. Glaucoma is a condition in which fluid pressure builds up inside the eye, and that can cause damage to the internal structures and may lead to blindness. Medication is available to reduce the pressure in the eye by reducing the production of aqueous humor, which is the fluid that is found in that chamber of the eye. Uveitis is inflammation of the uveal tract, which includes the iris, ciliary body, and choroid. The cause is often unknown, but could include trauma, infection, or an autoimmune disease. Anti-inflammatory drops or ointments are used to treat that to calm the inflammation down. Retinal detachment occurs when the retina separates from the underlying choroid layer. This separation can cause damage to the vision. Early symptoms of detachment include flashing lights in your vision, floating black shapes as a hole in the retina forms. The hole in the retina can be repaired in a procedure called cryopexy. This uses a freezing probe over the tear, which creates a thin scar and seals the hole. It is extremely important to seek medical attention immediately if you have retinal detachment. Otherwise, it could lead to permanent vision loss. Diabetic retinopathy, we will discuss more next semester when we cover the diabetes chapter in chapter 33, the endocrine system. Macular degeneration is degeneration that happens as a person ages and is the leading cause of blindness in the elderly. With this one, central vision is lost first, so right down the middle when you're looking straight ahead. You might notice it with difficulty in reading. Laser surgery may be helpful to restore some vision if done early or could prevent further deterioration of that area. Myopia is nearsightedness. This is a condition in which images of distant vision or distant objects come into focus in front of the retina. Nearby objects are usually seen clearly, but far away is blurry. Hyperopia is a condition in which images come into focus behind the retina. Far away objects are usually seen clearly, but close-up ones might be a little bit blurry. Presbyopia is a form of farsightedness that occurs as a person ages, secondary to the loss of accommodation of the lens, which is where you're able to look close up and then immediately look far away, and your lens accommodates for that distance change and can still see. So as you age, you lose that ability to accommodate, and so you can have some farsightedness because of that. Astigmatism is where the vision is distorted because the cornea is unevenly curved or the lens has an abnormal shape. This is treated with corrective lenses, laser vision corrective surgery or LASIK, and the goal is to correct the curvature of the cornea. Some exams that we might do for vision screening could include distance and near vision. We use the Snellen chart, which is your typical big E chart, to check for distance vision. This Snellen chart does come with either symbols, letters, or hands pointing in a certain direction. Those can be used based on the patient. You might change which Snellen chart you use, whether it's the little symbols or the letters or hands pointing a certain direction. You'll want to make sure you're using a table that your patient or a chart that your patient actually understands. A preschooler might not know what all their letters are, so you wouldn't want to use one that has letters on it. However, they might understand one that would have pictures on it, like little, pictures of a heart and a star. So the biggest thing with that is that before they do the test, you need to go through the chart with them, as in, can you tell me what you see here and point to a picture? And can you tell me what this looks like and point to a picture? And bring it close up to them so they can see it, because a plus sign on the chart might be a plus sign to you, but to them it's, add a life in their game or a new life in their game. A heart might be love to them, where it's a heart to you. So you want to make sure that you're on the same page with the patient as to what the picture they're seeing, what it means to them. For near vision, you use what we call a Jaeger chart. It uses handheld cards that contain letters, numbers, and paragraphs in various print sizes. You view those close up, and they determine if you have any issues with your near vision. For color vision, you will see something like the green circle down at the bottom with the number 12 in it. That is called the Ishihara color screening test. We also have the Richmond pseudo-isochromatic color test, which includes letters, symbols, and numbers made up of different colored dots, surrounded by colored dots of a different color. And that tells us if the person has any issues with their color vision. Contrast sensitivity checks to see if they can distinguish different shades of gray. We also do an eye exam, and the acronym for it is PERLA. It is pupils size, so what size are the pupils? Are those pupils equal on both sides? Are they round? And are they reactive to light and accommodation? So how we check to see if they're reactive to light is you would turn a flashlight on, or like a little pen light, put it into their field of vision, and then move it out. You should see that pupil and the iris get bigger and smaller, bigger and smaller. Smaller when you put the light in the field of vision, and bigger when you remove the light. Also, if a person looks close up at something, so something close by them, and then looks far away, you should see the pupil and the iris constrict and relax, constrict and relax. And that's almost like, if you think about it, when you're using a camera, when you're trying to focus on something, you'll see the camera kind of adjust. That's that accommodation that you might be able to actually see in the eye when you're checking vision. There are a few YouTube videos there that you can watch. You can use the links below or in the PowerPoint slide to take a look at those YouTube videos if you'd like. Patients with special needs. Certain patients may need special attention when having vision tests done. Sometimes kids are difficult to comply, and it's not because they don't want to comply, it's just they don't understand what they're doing and why they're doing it. Some patients with Alzheimer's disease or dementia, or if they're confused, may have difficulty with this. Your goal is that you want to use simple language to explain the procedure, give directions frequently if needed, or repeat them if needed. Have family members try to help if possible. We will talk about eye medication next semester, and we already did eye irrigation when we did the eye wash station. Some common disorders of the outer ear, and some of these will be a repeat from chapter 34. Cerumen impaction, which is where earwax builds up in the ear. can make it so people are having difficulty hearing, might feel like they're, have something in their ear. They can hear themselves kind of talk, might feel like it's muffled. Otitis externa is swimmer's ear. That's typically a fungal infection and it's in the external ear. Pruritus is itching in the ear canal. It's a common problem with the elderly because as they age, their sebaceous glands produce less wax, and it becomes dry and itchy. Usually using a few drops of mineral oil will solve this problem. Otitis media is a middle ear infection. Mastoiditis is inflammation of the mastoid bone, which is located just behind the ear. It's connected to the middle ear by air cells or sinuses in the bone. Mastoiditis is serious because of the close proximity to the organ of hearing, the covering of the brain, and the jugular vein. And you may need surgery for severe cases. Otosclerosis occurs when the bone tissue grows abnormally around the stapes or the stirrup, which is the innermost of the three tiny bones connecting to the eardrum. The stapes becomes immobilized and vibrations to the inner ear are not possible, so this causes hearing loss. Tinnitus is ringing in the ears, and that is a symptom of otosclerosis. The next one down is ruptured eardrum. It can result from the insertion of a sharp object, an explosion, or a blow to the ear, or a severe middle ear infection. The eardrum can rupture by a sudden change in air pressure as well. It will usually heal over the course of a few weeks on its own, but sometimes the licensed practitioner will put a temporary patch or a patch over top of that hole. Labyrinthitis is an infection of the labyrinth. It's most commonly caused by a virus. The labyrinth includes the semicircular canals, which are involved with balance. An infection could cause a person to be dizzy or have the symptoms of vertigo. Meniere's disease is an increased fluid in the labyrinth. The pressure of the extra fluid disturbs the sense of balance and can rupture the labyrinth wall or damage the cochlea, which is where the hearing receptors are. The symptoms may initially mimic the flu with nausea and vomiting. Medications may be used to combat the vertigo that is caused and the upset stomach. Some people find it helpful to follow a low sodium diet or use a diuretic for fluid retention relief if there is an extra accumulation of fluid there. Presbycusis is a type of hearing loss, most common in older adults. Hearing aids may be of assistance. Us as medical assistants don't really do too much with hearing aids. Audiologists do that. They will get them all set up, instruct them. However, it's not uncommon for patients to have hearing aids, and us as medical assistants have to work with patients that have hearing aids. And so just being aware that some people will have hearing aids and some people may be hard of hearing. Tinnitus is ringing in the ears. Conductive hearing loss is caused by an interruption in the transmission of sound in the inner ear. Sensorineural is where the actual nerve signal that leads from the ear to the brain or in the brain itself, there is an issue there. It's not in the conduction of the sound, it's in the nerve signal of the sound. When we have patients who have hearing impairments, you want to speak at a reasonable volume. Don't yell at them or raise your voice really loud. Speak in a clear, low-pitched tone. Avoid speaking directly into the patient's ear. Avoid overemphasizing your lip movements because they are typically used to reading lips, and it can make it very difficult for them to read lips if you're over-accentuating or overemphasizing those lip movements. Avoid gestures unless they're appropriate, like hand gestures. If the patient does not understand it, you can simply restate it. It's also good to put it in writing. Sometimes that is helpful too. And then be patient and have respect. Some hearing tests. For hearing tests, they do the Weber test and the Rhine test. Both involve the use of tuning forks. I will tell you most of the time these are done by the physician or the audiologist in like an ENT's office, ear, nose, and throat doctor's office. We as medical assistants don't typically perform these tests. However, what it does is it uses a tuning fork. You guys are familiar with that from MA 102. And they would hit that on a hard surface. There would be a noise coming from that tuning fork, and then they would either place it somewhere on the patient's like head, around the ear, forehead, behind the ear, or they would take the tuning fork and move it away or closer to the ear. An audiometer is an electronic device that measures acuity by producing sounds in specific frequencies and intensities. That's when you go into the office and they say, okay, we're going to put these headphones on you. And you just raise your hand when you can hear it and raise the hand that you can hear it, that ear that you can hear it in. There are a number of complete fluctuations or waves, energy that pass a specific point in 1 second. Frequency is best described as the pitch of the sound. When you're doing these tests, they will give you different frequencies or pitches of sound to see if you can hear all of the different frequencies. A tympanometry measures the eardrum's ability to move. This is an indication of how much pressure is in the middle ear. When we talk about earwax or foreign body removal, we'll do a procedure in lab called an ear irrigation. That will help remove compacted earwax or cerumen in the ear. You want to make sure when you're doing ear irrigation that you use warm water. You don't want to use cold. You don't want to use hot. That can be painful. It can cause the patient to get a headache, can cause them to be dizzy, lightheaded, nauseous, lose their balance. When you're irrigating, you want to make sure that the patient does not have tubes in their ears, or they haven't had recent ear surgery or surgery on their ear. You also want to make sure that when you're aiming the irrigation tool, whether it's the elephant ear washer, which you see on the right here, it's called Tridal Wave, I think is what it says on there. Or if you have a syringe, like on the left side, either way, you want to make sure that you're not aiming directly at the eardrum because you can rupture it. So your goal is that you're aiming at the wall of the ear canal and trying to get the fluid behind the obstruction so it can flush it out. There's some additional information about hearing aids there. They're typically done with an audiologist. They'll have a fitting and give them instructions. A cochlear implant is an electronic device that stimulates the auditory nerve. It does not amplify the sound, but they do send signals to the brain through the auditory nerve. And that's it for that chapter.